Ready?
Okay.
So, Lucas, it's been 7 days, man, since we gave you your teeth. But how do you feel?
A lot better.
Yeah? Yeah?
Yeah.
So what's better about this?
Being able to smile,
Yeah.
not having to worry about it so much.
Yeah.
Being able to eat.
So what are you eating these days?
Actually, solid pieces of meat again.
Okay. Okay. Good.
That was after, I think about 3 or 4 days, I was able to, and stuff. So it was really nice. I was happy.
And you were just telling me about, getting used to smiling again.
Yeah.
Tell me more about that.
I'm so used to not smiling. It's just trying to break the habit of hiding it.
Yeah. And what did you used to do, like, before when you were hiding your smile? What did you...
Look the other way, put my hand in front of my mouth, pretty much all the normal stuff to hide it.
Yeah, and now you got to kind of remind yourself that...
now I'm trying to remind myself not to hide it.
Right. So just tell me, Lucas, going way back, like, what happened? How did your teeth end up in bad condition?
Always had problems since I was a little kid.
Okay.
And now the dentist put me to sleep as, like 12 years old even, to do so much work. When I became injured, the medications they had me on really took it even further.
Yeah.
And chipping and stuff from not even eating or anything like that, just chipping on its own.
Yeah.
And it just finally came to the point, where couldn't do much of anything anymore.
So, you were going to the dentist and they were trying to fix your teeth? Or?
Yeah,
okay.
I had, I don't know how many times I've had constant fillings. I would have about 12, 13 fillings done at a time.
Wow.
And then another year or two go by, I had another 10, 12 fillings go.
And then they would just
end up just pulling the teeth as they kept going and stuff like that. I just couldn't keep saving them.
Yeah. Now, how did you find us, Lucas?
TV.
TV, okay.
Yeah, saw you on TV.
Okay.
I was, I think it was like a Saturday or Sunday.
Yeah.
Slipping through the channels, and I've been wanting to do something with my teeth because I hated it so much that all of a sudden saw you, wrote down your number, called.
Awesome. And, how did you feel like before you had this treatment done?
Let's see. Hard to explain. Not confident.
Yeah.
I would just say lack of confidence.
You just kind of didn't feel yourself, huh?
Yeah, pretty much.
Yeah. Did you always feel like people were looking at you?
Always staring at my teeth, or anything that's wrong with me, they felt like they're staring at me. Mostly my teeth, obviously.
Yeah. And yours were a result of just a bad incident in your life, and your medication, and your teeth just kind of...
Yeah, I would even have teeth come in with cavities when they were coming in, my adult teeth, when I was a kid.
Okay.
And so
just soft teeth.
Yeah, just always been dealing with that, and so it's going to be so much nicer not to deal with that no more.
And I remember when we met, you said, you made a comment that I won't forget. You said that you always thought that people thought you were a drug addict.
Yeah.
Like they'd look at you.
Yeah.
Like describe that. What?
It's the feeling. Basically, anywhere I go, pharmacies, anything, the feeling that I get is that I'm using drugs or something because I'm missing teeth.
Right.
And it's obviously pretty a stereotype that goes along with it.
Right.
Pretty much, I get that kind of feeling. They look at me. Sometimes, to me, it almost looks like a disgusted look, like they're kind of grossed out by the way my teeth were.
Right.
So it's a bad feeling.
Right. I lost one tooth. I mentioned to you, early in my life, and when I didn't have that tooth there, it just made me feel, like ashamed of myself.
Yeah.
I felt embarrassed. I didn't even leave my house for 2 weeks until I got that tooth replaced.
Yeah.
And so, when I see patients like you who have a lot of missing teeth, I know what it feels like because I went through it for only 2 weeks, let alone how many years did you go through that?
Oh, at least 4 or 5.
Yeah.
At least 4 or 5. We're starting to miss the fronts.
Yeah.
And because you saw I was missing the whole side and the top, and it's just, it's embarrassing.
Yeah. And now, we had the procedure done. Can you describe the procedure, like what we did and how you felt throughout it?
It was, honestly, it was easy. It was not bad. I thought there was going to be more pain. Obviously there's pain, after the procedure, but that's...
How bad was the pain?
level of 1 to 10, I would say maybe an 8 for a couple of days.
Just for a couple of days?
A couple of days.
Okay.
Most, yeah, and I've been through a lot. And so that's not bad.
Okay.
And but every day you can feel it getting better. I wake up and there's not so much pain, there's not so much soreness, and so I absolutely love that.
Because right now we're 7 days out.
Yeah.
Right. We did this last Friday.
Last Friday.
And how do you feel today?
So much better.
Yeah.
So much better. Yeah. Even when I got back from last Friday, when I got home, I felt a lot better.
Okay.
Woke up as I got home and everything, and just having new teeth.
Yeah.
Made me feel so much better.
Yeah.
Going outside isn't, seem as much of a problem for me.
And do people notice your teeth?
Everybody.
Really?
Everybody loves it.
What kind of feedback are you getting?
I get that I look really handsome.
All right.
I got that the other day.
Awesome. How long has it been since somebody told you that?
A long time. And then also just that they really like it. They like my smile.
Good.
And stuff.
Good.
Especially my parents.
Yeah. Because your parents. I mean, this is a result of essentially a gift.
Yeah.
From them.
Very much.
I'm sure you're very appreciative.
Very much so.
Yeah, it's some awesome parents, man.
Oh yeah.
Yeah.
They do a lot for me.
Yeah.
And for my kids.
Right. But now you're getting your life back on track. And you got your teeth, and so where do you see yourself going now?
Not so much worrying. Honestly, it was a lot on my mind.
Really?
it was constantly, am I going to be hurting? The infections hurt bad.
Yeah.
Stuff like that. Now I see it as pretty much just a lot less stress.
Yeah.
A lot less off my mind.
I mean, you're just worried about your teeth.
Yeah.
Wow.
Constant pain.
Wow.
And stuff because it hurts. The infections. Just nonstop.
So the amount of pain that you had after the procedure, after getting your brand new teeth, compared to the pain that you used to have,
is way better.
Okay.
Because the difference between the infection and just the healing is so much different.
Yeah.
A lot better.
Good. Is this something you'd recommend for people that are considering?
Anybody.
Yeah.
I recommend it to anybody.
Yeah.
Actually, I do have a friend that has missing front teeth, and he's been thinking about it, and so I'm recommending to him.
Awesome.
It's worth it.
Yeah. Well, a referral is the best compliment you can pay us. It really is, man.
Okay.
So,
okay.
but can you describe exactly what we did? Just so that people that are interested in the type of treatment that we did for you, we call it Teeth in a Day.
Okay.
Can you just briefly describe in your own words what we did?
On last Friday?
Yeah, last Friday.
Remove my remaining bad teeth and put the implants in.
Right.
And put the teeth in.
Yep.
And that's it.
That's it.
That's simple. It's simple. To me,
you made it sound so simple, right?
To me, it was just more time consuming.
Yeah. And we sedated you for this. So what was that experience like?
Oh, very calming.
Yeah.
I took the medication I was supposed to in the morning.
Okay.
Pretty much fell asleep.
Yeah.
My father came in and got me.
Yeah.
And took me to the truck and brought me here, and I really don't remember a whole lot.
Yeah.
It was very calming. It's no stress at all.
Yeah. You're very relaxed.
Oh yeah, and this is the first place I've ever been relaxed at the dentist office.
Really?
Never anywhere else.
Really?
Nobody else. Everybody's made me nervous and stressed out and everything.
So how has my team treated you?
Oh, very awesome.
Yeah.
Never had such. What would you say? Everybody's just so polite and nice, and if you have a problem, you can talk to pretty much anybody here.
Because you know why, right? If they're not, I fire them.
Oh, we have that on tape now.
No, you know what? We have an awesome team. I mean, my team here is just unbelievable. Just great, good-hearted people that sincerely care about people and want to do the best.
I see that they actually care.
Yeah.
And not just here for the work.
Yeah. No, this is a passion of ours,
Yeah.
And I hire people that are really passionate about helping people like you. And, we've treated a lot of patients just like you. And
yeah.
We're blessed. We're blessed that we can provide the type of treatment, and we're really, our goal is to improve your quality of life. And would you say that we did that?
Very much so.
Okay.
I mean, I couldn't ask for anything more.
Yeah.
I love them.
Yeah.
as I get used to them, I think things are just going to get easier and easier.
Yeah, it is. Yeah, and you know, I think the biggest things, like as you mentioned it, you're more confident.
Yeah.
You know, when you have a beautiful set of teeth, just the confidence just shines right through. You know
Exactly.
what I mean? And
Exactly.
you're now you're holding yourself up tall.
Yeah.
And your hand's not coming to your mouth even as we speak. You know?
Exactly.
So that's pretty awesome.
I started breaking that habit right after
Did you really?
trying to, you know, and
like, get that head down. Huh?
yeah, exactly. And it's starting to feel more like my own teeth.
Yeah.
There was pressure, you know, at the beginning,
Yeah.
where it felt like something else was there.
Yeah.
But as, you know, 7th day into it, it feels way more natural than, you know, when you just first went in.
Hey, well, it was a pleasure, Lucas. I mean, you're a great patient. You've been doing everything we've asked for. You know, you're here when we need you to be here. You're taking care of yourself at home like we asked you to, and I think that's going to be the end result's going to be success. Ultimately, it is already. You know, right now you're in the healing phase, so you know we just want you to continue to take care of yourself.
Oh, definitely,
And, But do you mind if I get some close-ups of your smile so I can show people?
Sure.
All right. Let's see. So go ahead and show everybody what we did for you, my man. Awesome. So you're still just a little bit numb there.
A little bit.
Yeah. But we did the upper teeth, and maybe sometime in the future we'll do the bottom. But right now the top is what.
Top looks good.
The
Top is
top-
what was really bothering me.
Yeah. Exactly. Well, thank you very much, Lucas. I appreciate you coming in and just sharing with everybody what we've done for you, my man.
Oh, thank you so much.
All right. Thanks, buddy.